You're listening to the Outside the Box podcast
with Mike, Gwen, Alex, and Lee from Outside the Box Associates.
Every month, your host will have a real-world discussion about rights and topics that many of us take for granted.
From a different perspective, the lens of disability advocacy.
It may look a little different,
but we live, we laugh, and we love just like everyone else.
And we share the same rights as everybody else.
Join us as we explore the practical aspects of these rights.
It may just change your perspective. Hi, and welcome to another great episode of Outside the Box podcast. Today, we are going to talk about medical simulations that help future medical professionals know what it's like to work with people with disabilities. I'm Mike Rogers.
I'm Alex Jesko.
I'm Gwen Squire.
My name is Lee Hartley.
Within the last 10 years, I know of one incident that I had with a doctor. I was having a follow-up to a urinary issue that I had, and we were going through it, and he was just asking me how I was feeling and all of that. Then when I got out of the appointment, which was about 20 minutes later, the lady at the desk asked me when I wanted my colonoscopy. And I'm like, my colonoscopy? What do you mean my colonoscopy? And she goes, yeah, the doctor has you down to get a colonoscopy. And I'm like, no, I don't have a problem with that. There is no need for a colonoscopy. So she goes back and talks to the doctor, and he goes, oh, that's not something about, oh, that's not what he needs or something like that. I couldn't hear because it was kind of muffled.
Right.
And but obviously he did not know what I was talking about after that 20 minutes. That's why I think this episode will be great. And I'll chime in, but I'm gonna leave it up to the people that have dealt with these simulations before. Go ahead, guys.
Okay. So I've done these simulations 2 or 3 times now. I've loved them every time because it gives us the ability to talk to the local medical students about, what it is to be a person with a disability, about our disability, and gives them the ability to build some comfort with people with disabilities, which is really, really cool. One of the things that I love about going in there is, the first question I'll usually ask is, hey guys, so have you guys heard about cerebral palsy? Do you know what it is? Do you understand it? And, to some degree, a lot of them do, but a lot of them sometimes don't. So it's kind of cool. We get to go in there. I get to discuss what cerebral palsy is for me, my medical history, my experiences with medical professionals. It's been a really cool experience. For the times that I have done the mock illness situation for the second years, it was really cool because they kind of give you a script and they tell you, these are your symptoms, this is how you're supposed to act, yada yada yada. And it's kind of funny because what the medical students will do, the reason why they do this is to build comfort with people with disabilities. So excuse me. So one of the things that one of the medical students have done with me in the past was I was sitting on the opposite end of the room. And so they have that long, I think it's called another stethoscope. Whatever the thing is that they look in your ears and in your mouth with. That one thing with the cord. Yeah. What is it? I don't know my medical terminology, guys. You'll have to excuse me.
Yeah, neither do I. Not that stuff anyway.
I call it an ear glass.
Yeah.
Was it?
But anyway.
Say it one more time, Lee. Sorry.
Or disco.
Oh, okay. Cool.
Oh, there you go.
So that's what that is. Okay. That I learned something new today, guys. So anyway, one of the medical students dragged it across the room, didn't ask me to move, just pulled the cord as far as it would go, and it could barely reach me by the time it got over to me. And so I'm sitting there like, are you sure you want to do that? You want me to move? Because that thing looks like it's about to snap off the thing. He's like, no, I got it. He was really nervous. It was really funny. So um I'm sitting there kind of laughing at myself and this because what people have to realize is just because we're people with disabilities doesn't mean we can't accommodate to the equipment or to what the doctor needs. Some of us can move and can accommodate to what they need. So it's important always to make sure to verbalize, um, if something needs to be done, and if it's a case where the person is in a wheelchair, of course they can just roll over, roll across the room or whatever. So it wasn't that much of an inconvenience, but it was funny to see how much they were willing to accommodate, um, my perceived lack of ability and, try to make it work. It was really kind of sweet, but at the same time, it was really hilarious. So, um, yeah. Gwen, why don't you talk about your times with the medical
Yeah,
students?
I actually agree with you, Alex. I think it's kind of funny.
Yeah.
Um, what was I gonna say? I always find it real interesting, like to see what like people's perceptions are and stuff,
Mm-hmm.
Like when I tell them about the fact that I have spina bifida, what spina bifida, I ask them if they know what it is. Some of them say that there's like a brief, blurb in their book about it, and I'm kind of amazed because, you know, I know a bazillion people with spina bifida. You know what I mean?
Mm-hmm.
So, but anyway, my favorite part is probably the part where I get to give them the feedback because then I get to say to them, like you have, Alex, don't be afraid to ask me to move my wheelchair, or as I was telling you guys before we came on, um, some of them won't even, when they're asked by the facilitator of the simulation to, examine me, none of them will volunteer. And it's like, okay, guys, I don't bite, I promise.
Mm-hmm.
Unless you make me mad, then I might have to bite you. I said, "What do you need to volunteer and just examine me?
Yep.
It's not going to hurt me or anything." And, then they'll be like, okay. And what I do like also is when they tell me what they're going to do as they're doing it, as opposed to just doing it. Or they tell me if I'm going to hurt you anyway, let me know, or something like that. They can be like that. Other times I've had people who've been very kind of abrupt, and I
Mm-hmm.
didn't know if it was just their lack of knowledge, of
Mm-hmm.
not knowing somebody with a disability or how to interact with somebody with a disability per se.
Mm-hmm.
So, but I really like the program that I go to at the University of Buffalo. I go there every year around between February and March, and I work with the second year med students, and
Mm-hmm.
I really enjoy doing it. I think it benefits them, like you said, Alex. I really
Mm-hmm.
do. It helps them get comfortable to know that people with disabilities aren't, maybe they perceive us a certain way and we're not, you know what I mean?
Mm-hmm.
It's dealing with those perceptions that they have of us. I don't know
Yeah.
what they think sometimes.
Yeah. And I mean, to be honest, it's important to, address that early on in their careers, for lack of a better word, because frankly, I mean, if you're not comfortable working with somebody with a disability and somebody with a disability comes in with an illness,
Right.
I mean, you're kind of
Yeah,
SOL in that regard. So
exactly.
it's good to introduce, but also it's really cool because a lot of them usually, in my experience, a lot of them have had experiences with, loved ones or friends who have had
Right.
disabilities, things like that, which is really cool.
Yeah.
The other thing I will say is that one of the trainers, Paul Lonsberry, does a really good job about putting on a presentation beforehand about people with disabilities and the history of people with disabilities as well. So that really does help a lot too, because it gives
Right.
them a bit of background as far as like, our history and that kind of thing. And
Right.
they really push the idea of people with disabilities are just like anybody else. We just navigate the
Exactly.
world differently. So yeah.
Right. Exactly. I agree.
Yeah.
Yeah.
Lee, do you have any would you like to jump in?
Um, not right now.
Okay,
Okay.
cool.
I want to add something, guys. You know,
Just go for it.
one time I had to go to the emergency room for something, and you know, at that time I didn't have a vehicle available. I it was probably late fall. I had to get to the emergency room, so I went from the city area of Buffalo to one of the suburbs, to one of
Mhm,
the on the bus,
Mhm.
on
mhm,
what we call the big bus or the fixed route, which took about an hour, you know, an hour and something to get there. And then when I got in there, they're like, "Well, who's with you?" And I'm like, "Well, nobody, because I had to get here, you know, to deal with this." And you know, I just, you know, I came on my own. And they were like, "What do you mean you came on your own?" I go, "Well, I came on the bus." And they were
mhm.
like shocked at this. So uh, so I was like, how, you know, because I use a wheelchair, and I'm like, well, how are you going to get me up on the table? I'm like, I could do it,
Mhm.
but if I do it, you won't like that because it's against probably all the rules of safety. So
Yeah.
so so I said, either I do it, or you, or we get somebody to do it. So they got three people. And what I thought was so interesting is one of the nurses was kind of talking like a little childish to me before, but
Mhm.
when she heard that I, you know, went on the bus on my own, that I live in my own place, she automatically started talking to me like an adult.
Oh wow.
So,
Oh,
so
okay.
I, you know, so I think I educated her, and I think that's what's great about programs like that, in that people get to actually experience the reality, but also the sameness of people with disabilities. That we're not that much different. When we have a medical issue, it's the same as your medical issue, even though it may affect us a little differently or
Mhm.
whatever.
Mhm.
Right. I agree. So you were talking about colonoscopies before, Mike. I've had plenty of those. They're not fun. I mean, they're not terrible,
No,
but they're not the greatest either.
no,
But anyway,
I would not wish that on anybody to do that. I have to do that. The prep is
exactly.
worse. The prep is worse than
I
the
was,
procedure.
yeah, I was just
Mhm.
going to say that the
Yeah,
prep is the worst. But anyway, I've actually had good experiences with that with the doctor I've gone to past several years.
Mhm.
When I first went to my primary doctor, though, um, she was really cool about working with me because I had been looking for a doctor that would be willing to work with somebody with spina bifida, and I had run into some roadblocks. And she was, Dr. Hoffman was like, "Well, Gwen, if you're going to teach me about spina bifida, what I don't know, and because you can't learn from books and stuff, and I'm going to help you out with your health issue, your other health issues that you have, the quote unquote normal ones, like a cold or whatever." And I'm like, "Great!" And I've been with her ever since. I've loved her. But I've had other doctors, do just the opposite. They didn't want to touch me because they didn't know anything about spina bifida.
Wow.
You know,
Yeah,
that's why that's why I love those simulations
yeah,
in
I've had
those.
I've had regular doctors ask me what is CP, you know. Uh, I've had that happen before. I've walked into a doctor's the doctor will walk in and sit down with me and go, "What is cerebral palsy?" And I'm like, "Are you kidding me?"
yeah. You know, I think sometimes that I understand they may not know everything, but they should know some of these disabilities.
Absolutely.
You know, in some ways, we should not have to be educating them on the basic definition of what the disabilities are, and some of the way they can show themselves.
Yep. Absolutely.
I mean, I don't expect them to know everything, you know, because they don't experience it every day or know all the, you know, the things that can affect people. I don't expect that, you
Right.
know. Right. That would be like saying to me, "Okay, Mike, fly up to Mars in this newly created spaceship,"
Right.
and I'd be like, "Well, how do you do that?" You
Absolutely.
know.
Yep.
So yeah, I think these are very beneficial. and I hope they take them throughout their career and use those as models.
Right.
Yeah, it's really cool because every year, it's different students and things like that with the program. So obviously, because they graduate, but
Right.
it's really nice because in some ways, we get to be the first people that they get to work with as people with disabilities. Some of them, not all of them, obviously.
Right.
But that's really cool because we can kind of be like, it's okay, you're doing just fine. You don't have to, overcompensate to the nth degree. So that's really, really cool.
Right.
It just gives them the ability to feel a bit more comfortable because we can build a dialogue, which is really, really great. So
Yeah,
Right.
and let them know that they can be human. I mean,
Right.
that they don't have to be perfect and know everything, and because we don't know everything about our lives as people. We know a lot, but I'm not going to say I know what it's like to be Alex or Gwen, or it's the same
Right.
thing with you guys.
Right.
absolutely.
Yeah. What's funny? It's kind of a funny story I have. I actually hit on one of the second year students one time just to see how they would react because because I had overheard some of their like comments and stuff. And I'm like, let's hit on one of them and just see how they would handle it. Because they were acting all big show. Yeah, I can handle this and blah, 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 blah. So I
Mhm.
hit on them and the guy had no clue what to do. And I said, well, what would you normally do with a patient? And he said, I would have said you are a patient and I'm the doctor, and that's inappropriate. And I'm like, well, there you go. That is how you
Mhm.
handle it with somebody with a disability as well. You
No,
know, I thought it was hilarious. And
that's
actually, so did
great.
the people watching on the video, the cameras, because they were being watched. They thought it
And
was
what
funny what
what
I did.
what did he say to that, Gwen?
What did he say to that?
Yeah,
He
yeah.
thanked me. He thought it was a weird way for me to go about teaching him that, but in a way, it was a good way for him too, because now he knew he could just say, "Hey, whoa, wait a minute, I'm the doctor, you're the patient. You can't do that. That's inappropriate." I'm like, exactly. That's what you do.
Yeah, yeah, yeah.
So
Mhm.
Yeah, that's awesome. That's awesome.
yeah. So
Mhm.
and like I said, just from listening to them, I could tell they weren't going to know how to handle the situation, you
Mhm.
know.
Yep.
But it was just like, just do it like you would with anybody else. And I always tell them at the end, you treat people the way you'd want to be treated, your patients. You treat them the way you would treat your other patients too. Would you yell at
Absolutely.
them for this or that? You not yell at them, but like scold them for being being a little overweight or whatever. Whatever you treat us the same way.
Absolutely. Gwen, I was going to ask you, because you and I have been part of this program, is there anything
Yeah.
that you would change about the program itself, the way they do it?
Um, let's see. I don't think so. Except maybe like the only thing I would probably change would just be the time we're allowed to be spending with them. Like,
Hmm.
I think we get it. I want to say we get like 15 minutes or maybe even a half hour, but I don't think so. But we have to do all that. We have to do the role playing, like pretending to be six. They have to examine us, and then we get to give them feedback. So sometimes I kind of interject in between if I'm not supposed to, because I know it has to be. We have to speed it along
Right.
and get going with it, So like you, I'll say, do you need me to move? You can ask.
Right.
It's okay,
Yep.
I do that.
Yeah.
That's what I just wish was different.
Yeah, I would say also, I wish that more students would reach out to us as well if they have other questions or things like that. I mean, I always tell the
Right.
teacher and the students, like, if you want to reach out, here's my email, here's my phone number. If you have other questions
Oh
about
yeah.
people with disabilities, let me know. Um, but also just spending more time with the students and really getting to know them better, because I
Yes.
feel like oftentimes, 1 or 2 days is not enough with people with
Right.
disabilities, because
Once or twice a year. That's it. Yep.
yeah, we are such a variety of people, because everybody,
Right.
as Mike was saying, every disability, or every person with a disability rather, is different, and it's going to
Right.
affect everybody differently. So I think they
Right.
should see a wider scope of people with disabilities as well. I mean, they do get to see a rather large scope because there are, 5 or 6 of us that go in with various disabilities, but
Right.
we don't represent the whole of everybody that has those disabilities either. So,
Right. And not everybody with spina bifida is going to be like me. Not everybody with
exactly,
CP has CP is going to be like you.
exactly.
So, yeah,
I mean,
I'm just
Mike,
glad they've been
I mean,
including our friend Charlie. He has he's nonverbal. Well,
yeah,
actually, he's not nonverbal. He's just harder to understand when he speaks, a
hmm
speech impediment. I'm glad they include him as well because that's really important.
I agree. I mean, it's pretty funny because if you look, I mean, Mike and I are both have cerebral palsy, but we're very different people because we've that's the way we've grown up and that's the way we are. But it's funny because even though we have the same disability, we are very physically different in a variety of ways. Is that fair to say, Mike? I think so.
Oh yeah. Oh yeah. I mean, if you don't mind my describing a couple things,
Yeah,
I mean, I can use crutches and everything, but I have way more spasticity than you do. I
yeah,
mean, I can tell that just by watching you move, Alex.
yeah, yeah.
And not knocking me or anything, but that's just reality.
Yeah, right.
Disability affects people differently.
Absolutely. Yeah. Yeah, for sure. I would definitely agree with that. Mike, I mean, I know you haven't really done this part of this program yet, and I'm actually kind of surprised because, as an older advocate, I'm surprised that you haven't been involved in this program. But um, given what you've heard, is there anything that you would say would make the program better as far as anything we haven't mentioned?
No, um I think like you said they should reach out to the participants more, but I think what they're learning is how to how to interact, and once you are comfortable with interacting, then you can ask the questions that you need. And
Absolutely.
the only reason I haven't been involved in the program is there were days that they had that I just was not available. That's the
Right.
only reason why.
Yeah, that's fair. That's fair. Uh, yeah, I don't know. I really feel that this should be a thing that they do more often because, like Gwen said, it's like a twice a year thing, maybe not even. Uh, I mean, even during like COVID, I don't think we did it at all, to be frank.
Mhm.
Uh, but I mean, this is something they do maybe once, twice a year, but I think it should be more often, at least once a
Oh, I do
semester,
too.
at
Yep,
least.
at
Yeah,
least.
I
Yeah.
think that should be a regular thing for them.
So, um,
Yeah.
because and they also should be bringing in different people with different disabilities every time. That way they get a bit more exposure for,
Yeah.
but, but, Lee, did you have any comments on this? Or,
Yes,
okay, go ahead, dude.
I sometimes feel like David Bowie is the elephant man in the observations.
Oh, interesting. Okay.
Mhm.
Can you explain that a little further, if you would?
With certain doctors, they make me feel like I am on the examination table right then and there.
So it makes you feel dehumanized in a sense.
Yes,
Makes sense. Yeah, that's what we're trying to avoid by virtue of doing these presentations and stuff. So that's why I'm glad you're a part of them as well, because just like we were saying, you operate in this world differently as well. And because of that, it gives them exposure and builds that level of comfortability as well.
Yeah, I think sometimes we expect, you know, medical professionals to like know everything because medicine has become so advanced
Yeah.
that when they don't understand things, just like half of the population, we get shocked instead of saying, okay, we understand that you don't go through this every day, so this is the deal.
Yeah.
Right.
I do still find it rather amusing when a doctor, whether it's a general practitioner or whatever, asks me like, what is CP? And it's like, shouldn't you have some background in at least something in
Yeah,
Yeah,
exactly.
definition, the definition, something,
yeah,
Yeah.
something. But
Especially second
WebMD.
year.
nope.
Yeah, especially second year.
Yeah. Second year med student. Come on. You should
Yeah.
know.
Or some, well, I've had regular, doctors that have been out of school for years ask me what is CP,
Right.
so it's like, come on.
Yeah.
So
It's like you don't have a clue. You can't use WebMD.
you can't use,
Right.
or you can't use Google. I mean, come on, like,
Yeah,
Yeah.
I know. And it's not like it's like an unknown disability, Alex,
yep,
and
yep.
Mike and everybody. I mean,
It's one of the
or
most
even
No,
common
even
actually.
yeah, or even my disability. It's
Mhm.
not it's funny that it's not unknown. No. It's
yeah,
out there.
they're kind of the more common types of disabilities that you come
Yeah,
across.
exactly. That's kind
They
of what I'm
may
saying.
be testing you.
Say that again, Lee.
They may be testing you.
They may be
Oh,
testing me. Yeah, that's
I
Hey,
fair.
you
suppose.
never know
Yeah.
to see if
E-
we know what we're talking about.
This is true.
Even so, it'd be like asking someone, what is your name? It's like, do you really have to go that extreme?
Yeah, really.
I don't have a concussion. You don't have to ask me that.
I know.
But
Yeah, it's like that movie 50 First Dates or something like that.
Oh
exactly.
my
We
goodness.
don't we don't forget every day that we wake up.
Exactly.
Exactly.
Uh,
Now that I think about it, we probably know pretty much more than that, at least in the way it affects us, than doctors do. You know,
Yep.
how
yeah,
like my spina bifida and your CP, how does it affect either one of us?
Mhm.
That's something that's unique to us.
Absolutely.
yeah,
So they
But
don't know that obviously, but they should at least, like you said, know the definition.
yeah, absolutely.
Yeah. So,
yeah.
Mhm.
well, Mike, do you think that you would do something like that if you got the chance to?
Oh yeah, I would be willing to do stuff like that. Sure, sure.
Yeah. It would just have to be when it's easiest for you, though, of course, with your
Yeah,
busy
yeah.
schedule.
A lot of times it's during the day, and I'm just not free during that time.
Yeah.
Right. I get it.
But yeah, if I ever get a chance to do it, I would do it.
Yeah,
Cool.
that's
Does
cool.
anyone else have anything to add to this topic? Or are we good?
I think
Yeah.
we're good.
No, I think we're good.
Lee, you got anything else?
Yes.
Okay, go ahead, man. This silence is brought to you by Editing for Jim. Editing for Jim. Mhm.
I'm fine.
You're fine, dude. I'm just
You're
trying to
fine.
fill the silence.
Outside the box sleep music.
Yeah. This is the this is where we would have advertising. This is where our planted
Yes,
advertising would be.
yes.
I would
Lee's
I'm
writing Lee's writing a Stephen King novel here.
we love it. We love it. Perfect. It's perfect time for Halloween too.
Yes.
I actually thought about it. So I thought about this is a conversation we could have in the middle of this. Let us know when you're done, Lee. But I was thinking, what would be what would be the worst hell for a person in a wheelchair? And I was thinking, the worst hell for a person in a wheelchair would be a hell where they're stuck on an endless staircase, but stuck in their wheelchair.
That's true. Or an endless patch of black ice.
Yeah.
Yeah, that's for sure. I
And
actually kind of
everybody,
slid into a bus once. Nice.
Oh, geez.
I did.
Uh,
Freaked the bus driver out. And I
Speaking
was like, how
of,
do you think I feel? I couldn't stop the damn thing.
I realize this is gonna be posted after Halloween, but have you guys done anything cool for Halloween this year?
No,
not this year.
No.
I didn't do
no.
anything this year.
No.
Usually
Go ahead.
I'll do
Usually
something.
I give out candy at my niece's house, but not this year. She didn't ask me to.
Oh, damn.
I'll at least dress up or something. I didn't
Did
even
you
do that.
did you guys watch any movies or anything? Any Halloween movies?
I mean, I've been watching movies on and off.
Okay.
I saw the new Exorcist movie a few weeks ago.
How was
Oh,
that?
how was it?
It was, I would say that it was better than I thought it was.
Oh,
I,
okay.
I think they could make expound a little bit more on plots these days. They do that
Right.
with series, like on like streaming
Yeah.
media, but I think they could do a little bit better with movies these days on
Right.
plot expansion.
I've also noticed too that a lot of the remakes they do of certain movies, they don't compare to the originals. And
Exactly.
No.
yeah.
They don't.
Well, also, I think a lot of that is, I think back in the day, the original movies were things that people never thought of putting it on screen. And let's face it, they may have been better directors. I
Yeah.
mean, when you have different certain directors and stuff like that, some are better than others. I mean, back in the 70s and 80s and stuff, they just might have been really good,
Yeah. I
at
mean, look at
that
Alfred
certain
Hitchcock.
genre of movie.
Yep.
Yeah.
Look at Alfred Hitchcock.
Yeah.
Yep.
He was a good. He was good. Weird, but good.
Yeah. Yeah. Um, for those of you looking for something new to watch, there's a show on Netflix called The Fall of the House of Usher. It's really good.
Hmm.
I recommend it. It's on Netflix.
What is it called?
The Fall of the House of Usher.
Oh, is that pretty good? I felt like watching that.
Yeah,
Yeah, I've
it's
heard
pretty
of it.
good.
watch.
Okay.
As long as you're not squeamish around blood or guts, gore, that kind of thing.
Oh no, I
Mhm.
love that stuff.
Yep.
Yeah.
Good to know, Mike. I'm never going to make sure that I'm alone with you ever again.
Yeah.
Yeah,
I like.
you better watch out where you put those big long number two pencils. They're
Oh,
Yeah. Like
uh,
I like Halloween movies to have a plot, not just be all slash and gore
right.
for me
oh, I
personally.
know.
Yeah. But I got yeah, it's good. This show was actually had a decent plot line and everything, so it was a good show. Uh, and I've been watching some old ones too, Dracula Untold, all those,
Uh-huh.
the darker ones. Because I don't get me wrong, I like Halloween Town and all those creepy ones, but like at the end of the day, I've seen them already. I always look for something new, something different.
Hmm.
So
How you doing, Lee? You done tapping on that Flintstone tablet over there? I'm messing with you, Lee. That's all. I gotta mess with you. I wouldn't know you
Yeah.
all these years
I
if I
don't
didn't
know.
mess with you. Think you'll be done in about 7 minutes, there, Lee?
He's good. My client can wait a second. It's
Are
not a
you
big
sure?
deal. Yeah.
Okay.
She might come in on us, but it's no big deal. I just won't let her in until we're done.
Yeah. And I've kept Draco from barking, so it's all good.
Nice. Thank you, Liz.
How'd you do
Except for what he
that?
did.
How'd you do
Uh
that?
I actually didn't keep him from doing it. He took hold of my pillow. If you look at Facebook, I posted a picture and destroyed it.
Excuse me? Okay.
Yes.
I recall one time a bad experience with a doctor. I still had the ET2 in me after my injury, and the resident doctor came into my room and fiddled around with my ET2. As a result, I almost got pneumonia from his fiddling with it. And then, to top it off, the resident just said these things happen, leaving it up to fate.
Wow. That's that's really messed up.
Yeah, it is.
Yeah.
Uh,
Wow. Leaving
Uh,
these things happen.
yeah.
Well, that's I think that's a good example of why we have these kind of programs for doctors to go through.
Yes. I agree.
Oh,
Yep.
Yeah.
They also
Okay.
sometimes like to talk to them about their bedside manners.
oh, absolutely.
Yeah.
All right. Well, this has been fun, guys.
All right.
Yeah.
Yeah. What?
Oh, and I just wanted to say to you guys that this week I will talk to Jim because we're thinking about actually putting it on Spotify
Okay.
so that it actually has a platform. So I'll
Right.
talk to him about where we're at because he said he was
Okay.
going to look into something, but I'll see where we're at. We'll try to get it up on there
Nice.
Okay.
Okay.
soon, just so that it has a
Okay,
platform.
or tree.
Oh, nice. Yeah. Also, have a great Halloween, you guys. I realize it's tomorrow, but even so,
Yes.
hope you have a good holiday. Enjoy yourselves. Stay safe.
I don't want
Yep.
I don't want any of your treats, Lee. Goodbye.
Hey.
Nope. Bye, Lee. Bye,
Bye, guys. I'll see you later.
everybody.
Bye, Lee.
Bye.
Have a good Halloween, man. Mhm.
You've been listening to the Right of the Month podcast with Mike, Alex, and Gwen from Outside the Box Associates. The Right of the Month podcast airs every Thursday and Saturday evening at 8 p.m. Eastern here on Heartability Radio. Listen on Live 365 or www.heartabilityradio.com. We'll see you next time.